Can someone have both schizophrenia and borderline personality disorder? Can someone have both schizophrenia and borderline personality disorder? This is a question that many people may wonder about, especially when considering mental health complexities. The answer is yes. It is possible for an individual to experience both conditions simultaneously, a situation known as comorbidity. Schizophrenia is a long-term mental health disorder that primarily involves persistent psychotic symptoms. These symptoms can include hallucinations, delusions, and disorganized thinking. People with schizophrenia often face significant challenges in their daily lives, affecting their social and occupational functioning. On the other hand, borderline personality disorder is classified as a personality disorder. It is characterized by unstable relationships, intense emotional swings, impulsive behavior, and sometimes brief episodes of psychotic-like symptoms during stressful times. Interestingly, there are overlapping features between these two disorders. Both can involve disturbances in thinking and perception. For instance, individuals with borderline personality disorder may experience short-lived psychotic symptoms, such as hallucinations or paranoid thoughts, especially during emotional crises. In contrast, psychotic symptoms in schizophrenia are more persistent and central to the disorder. Research shows that while the co-occurrence of these disorders is not very common, it has been documented. Some studies suggest that around 17% of individuals diagnosed with schizophrenia may also meet the criteria for borderline personality disorder. Other research indicates that about 2% of females with borderline personality disorder may have schizophrenia. These variations in statistics can arise from differences in how these disorders are diagnosed and the challenges in distinguishing their overlapping symptoms. The causes of both schizophrenia and borderline personality disorder are complex and not fully understood. They likely involve a mix of genetic, physiological, and environmental factors. Some studies suggest that there may be shared genetic risk factors, but the core features and treatment methods for each condition differ significantly. From a clinical standpoint, recognizing both disorders in a patient is essential for effective treatment planning. Schizophrenia often requires antipsychotic medications and psychosocial interventions. In contrast, treatment for borderline personality disorder typically focuses on psychotherapy, particularly dialectical behavior therapy, which aims to help with emotional regulation and improving interpersonal skills. Managing both conditions at the same time can be challenging, but it is certainly possible with a tailored approach. Understanding the similarities and differences between schizophrenia and borderline personality disorder can help in making accurate diagnoses and creating effective treatment plans. This understanding ultimately leads to better outcomes for those affected by both conditions.